Hello guys, welcome back to a new video of Medical Management channel. So we are getting started with our pathology practical series, and just yesterday I have finished my exams, and today I'm doing the practical video. Let's start with actinomycosis. Actinomycosis. The word itself says mycosis, but it is not a fungal infection. Okay, it is a bacterial. It is caused by anaerobic bacteria named Actinomyces israeli. It is not a fungal infection. Never ever think it is a fungal infection. It is a bacterial infection, that is anaerobic bacteria, that is Actinomyces israeli, and it occurs in 4 types, that is cervicofacial, thoracic, abdominal and pelvic. Cervicofacial, thoracic, abdominal and pelvic. It is a chronic suppurative disease, and there is inflammatory reaction and granuloma formation. First, grossly we will see how it will appear. On gross appearance, there is a firm swelling in the region of the lower jaw initially, but later sinuses and abscesses are formed. The pus contains characteristic yellow sulfur granules. So what you can see, there is formation of a sinus. Okay, sinus at the angle of the jaw or upside of the jaw or neck region. Okay, there is formation of sinus, there is formation of abscess, and the draining pus is present, and sulfur granules are present. Yellow color sulfur granules. Okay, it is a chronic suppurative disease. Upon microscopic examination, inflammatory reaction is present. Granuloma with central suppuration. Center of the lesion shows the abscess and the periphery seen chronic inflammatory cells, giant cell and fibroblast. As granuloma formation is there, you will see inflammatory cells, giant cells and fibroblast. How is the bacterial colony? Bacterial colony are the sulfur granules characterized by the basophilic radiating filaments with hyaline eosinophilic club-like ends is seen in the center of the suppuration. So how it will be? Center will be blue color radiating filaments and surrounded by the club-shaped eosinophilic structure, matlab pink color structure. These organisms are demonstrated as gram-positive. Gram-positive means blue color filaments and also stained with GMS staining, that is Gamorre's methanamine silver staining. Where you have heard this GMS staining? In pneumocystis pneumonia. Pneumocystis pneumonia is a fungal infection of the respiratory tract, it is treated by cotrimoxazole. Okay, and it is an opportunistic infection. It can also be stained with a GMS staining, that is Gamorre's methanamine silver staining, while the periphery of the colony shows club-like ends with immunoglobulins are the best seen in Messen's trichome stain. Messen's trichome stain is a permanent stain. Okay, this is the microscopic. There is inflammatory reaction, there is granuloma formation, and central will be blue color radiating filament surrounded by the eosinophilic matlab pink color structure, and it is a gram-positive stained by GMS staining and Messen's trichome stain. It is a very classical picture, and grossly you can see there is a formation of the sinus. Inside the sinus there will be pus draining. Okay, and sulfur granules will be coming. Yellow color sulfur granules. When you take on the cotton swab, you can see that granules are present. Okay, this is a very classical picture, and it is present at the angle of the jaw. And here one more picture is present. You can see them. A classical cases of actinomycosis. Okay, I hope you saw. Okay, upon coming microscopy on H&D staining, you can see this kind of structure, and most easily identifiable thing of actinomycosis is the most pink color stained in your microscope in your pathology is actinomycosis. Okay, the most pink color stained, it will be so pink that no other slide will be so much pink. Okay, that will be actinomycosis, and it is very easy to identify. This is a picture from the Hirschman pathology textbook. You can see a foreign body giant cell and center sulfur granules, that is basophilic in structure, and you can see surrounded by the pus cells. Pus cells are nothing but the dead cells. Okay, and surrounded by the lymphocyte. As it is granuloma, you can see lymphocyte, plasma cells and giant cells, and peripheral clubs. Peripheral clubs means hyaline peripheral clubs, it is eosinophilic. Okay, and you can see macrophages. This is another microscopic picture. On the left side you can see H&D staining. On the right side you can see the Messen's trichome stain. On Messen's trichome stain you can see central basophilic in structure surrounded by the club shaped hyaline eosinophilic structure. Okay, let me zoom. You can see now. Okay, I hope you saw. With this microscopic, I want to end this video. See you in the next part. Bye bye. Jai Hind, Jai Bharat.